Hello, this is Dr. Oviedo. This is the slide review for the lung tumors and pleural tumors. Slide 21 is the trachea. There is a separate video that reviews this slide. Slide 22 is normal lung. There is a separate video that reviews this slide. This is slide 23. You can see it is an approximately round structure. There are pieces of cartilage up here, cartilage here, and cartilage here. This is likely a bronchus, and there is a very large tumor inside the bronchus and invading through the wall. Let's take a look at high power. Here you can see these are highly atypical nuclei with moderate amounts of pink cytoplasm. This is the appearance of a squamous cell carcinoma. There are also numerous squamous pearls present in this tumor. This is a squamous cell carcinoma of the bronchus. This is slide 24. You can see these areas here appear to be normal lung, and the tumor is located over here. Let's take a look at high power. These are glandular structures lined by highly atypical nuclei with moderate amounts of cytoplasm. This tumor is invading through normal tissues. This is an adenocarcinoma of the lung. Slide 25 is on a separate link. This is a lung tumor biopsy that is composed almost entirely of tumor. Here on the upper left, there are small amounts of normal pleura. Let's take a look. You can see there is collagenous tissue in the pleura. This specimen does have an abnormal yellow look because this is a specialized type of stain, probably hematoxylin eosin with saffron or some other type of stain, which gives a yellow appearance. However, it doesn't matter much for the interpretation of the tumor. So let's take a look at the tumor. You can see there are highly atypical nuclei with moderate amounts of pink cytoplasm. This is the appearance of a carcinoma. There aren't really any good areas that have a lot of dyskeratosis, which would make it a squamous cell carcinoma, and there aren't really a lot of appearances of very good glandular structures, which would make it an adenocarcinoma. That's why it's called a large cell carcinoma of the lung. In real life, additional studies, including immunohistochemistry and molecular studies, would likely be done to confirm this type of tumor. This is a large cell carcinoma of the lung. This is slide 26. You can see there is a portion of pulmonary artery over here, and there is a small piece of cartilage here and a piece of cartilage here. Most of this tissue over here is all composed of tumor. Let's take a look at high power. At high power, you can see this tumor is composed of small nuclei. There is not much visible cytoplasm. This is the appearance of a small cell carcinoma of the lung. This is slide 27. You can see there are multiple pieces of tissue. Here's some normal cartilage, this is cartilage, here's cartilage, a small piece of cartilage here, and a small piece of cartilage here. Most of the rest of the tissue is composed of tumor. Let's take a closer look over here. This tumor is composed of groupings of cells that have fairly uniform round nuclei with moderate amounts of cytoplasm. This is the appearance of a carcinoid tumor. This is a bronchial carcinoid tumor. Generally, carcinoid tumors have nuclei with a salt and pepper chromatin appearance. This really is difficult to see on these digital slides. This is slide 28. You can see there is some normal lung here and some normal lung here. This up here is all tumor, and this is tumor down here. So this is a tumor that is going along the pleural surface, and it also is going along a pulmonary fissure. This, of course, is generally a behavior of mesothelioma. Let's take a look at high power. You can see there are pleomorphic nuclei with small amounts of cytoplasm, and these structures do appear to be forming some type of abnormal glandular structures. Mesothelioma does form glandular structures just like adenocarcinoma. These tumors are biologically different. The immunohistochemistry patterns would be different. Also, mesothelioma invades along the pleural surfaces, which is unlikely to be seen in adenocarcinoma. This is mesothelioma. This is slide 29. You can see there is pleura present at the top of the slide. The rest of the specimen is all tumor. Let's take a closer look at high power. This tumor has spindled nuclei in a collagenous background. This is a solitary fibrous tumor. Okay, that's it.